The Hill's Cheyanne Daniels will interview our next guest. Dr. Louise Gerberding, who ran the Centers for Disease Control and then pivoted over to private sector to work at Merck, is now the CEO of the Foundation for the National Institutes of Health. Welcome, Dr. Gerberding.
Thank you. Good to be here.
Dr. Guest, thank you so much for joining us today. We are going to talk a little bit about the importance of partnerships and trust today. So I want to start off, in your work at FNIH, there's a major focus on public-private partnerships, and you've called the successful partnership team science in its highest form. Why is that important, but especially for our patients?
Well, thank you, and thank you for having me here today. You know, when you step back, despite all the incredible advances in science, we still have some really tough challenges to solve in healthcare. And these challenges like mental health or metabolic disease, et cetera, really not going to be solved by a single life science company or a single NIH institute or a single investigator. It's going to take a partnership, wise crowd. It's actually tough for the government to work directly with the private sector. So organizations like FNIH really provide the middleware to bring these partners together, to raise the money to really accelerate their progress and to kind of herd the lions so that you move the needle down the field, the needle on the dial in a way that really advances the decision process and gets the job done. So you don't swarm the problem, you have an organized project managed approach.
We know that there's oftentimes this perceived sort of like competition, I guess, between public and private, and how do we handle it? How do we sort of dispel that notion if we're looking for that team science element?
You know, the most important thing in aligning the partners is the shared agenda. What is the overarching thing we're trying to get done? For example, partnerships like the Accelerating Medicines Partnership are a pre-competitive set, mostly of life sciences companies and NIH institutes, who fund investigators to try and identify new targets and new pathways in the more discovery phase of science development. And when you agree that that's the agenda, you can get people to really focus on, wait a second, what is it that we're trying to accomplish here? And I think one of the helpful secrets to that is to involve the patients and their communities in that effort from the very beginning. So at FNIH, for example, we have patients who are not just there as a N of one, but who really participate in the end-to-end development of the science. In fact, in our AMP for schizophrenia, the co-chair of the steering committee is a person with lived experience in schizophrenia. So that really also motivates people to always remember, oh, why are we here? Oh yes, we're trying to find better therapies for schizophrenia. And some of the other issues that can complicate the interpersonal relationships fall to the side.
Yeah, and I love that you brought up about lived experiences and having that connection with individuals who have a lived experience. In particular, really when we think about mental health, there is more and more attention being paid to mental health and mental illness over the last few years. How do we continue to improve, not just removing the stigma, but making sure that those with that lived experience are involved in partnerships like this?
Well, it is tough because reaching out into the mental health community and finding those people who A, have the time and the capability, but B, can get past the stigma and the challenge just inherent in carrying that diagnosis. Not everyone is willing to be forthright in a more public way. I think the broader issue isn't the participation of the patients, it's the lack of progress in the science. And we really need to accelerate the science of mental health disorders in the same way we've been able to accelerate the science for cancer, for example. But we are not finding a lot of new targets, and we're certainly not seeing a lot of life science companies really prioritize investment in mental health. So we do need to try to revitalize and energize. The National Institute of Mental Health has a very fine agenda to try to accelerate these efforts, but we need partners. And this is actually, for me personally and for FNIH, a really high priority for us.
I know another high priority or focus has been maternal, child, and newborn health. And we discussed this a little bit earlier with Congresswoman Kelly, but why is this such an important focus at this time?
Well, on a global basis, but even just focusing on the United States, our maternal health data are embarrassing at best, and in my opinion, tragic. To have a country with so much capability really have one of the worst maternal mortality rates of any developed nation, and worse than many undeveloped nations, is a tragedy, and it really speaks to the failures of our health system and the profound inequities that underpin it. So I think first and foremost, the problem is a glaring performance indicator of what's wrong with our system. But we also know how to fix it, and I think systematically tackling the three biggest contributors to maternal mortality: number one, infection, eclampsia, and the complications of birth in that sense, and then bleeding. We have medicines that can easily address these things, but we don't have our systems of care that assure that women are treated respectfully and have access to the early recognition of their risk and the appropriate interventions in the obstetrical setting. We can fix this, and in places that have really made that commitment and kind of implemented the airplane pilot approach of the check sheets, et cetera, we really can see improvements in maternal mortality, but we got to get serious about this.
One of the things that you mentioned there was about, and I might not be using the exact same word, but that element sort of like the respect to the patient. And I know particularly in communities of color, and I think many of us know particularly in Black communities, there is an element of distrust, in part from many experiments and previous history that could be pointed to, but also, and something the Congresswoman spoke to, is systemic racism. How do we begin to address the distrust that some of our communities have for our science and medical communities?
That's a hard question to answer shortly, but I think the first principle is basically trust is earned. And we have a history that has certainly caused a very rational decline in trust in some communities and in some patient populations. So we have to accept that. But you don't really combat trust with facts and information, however credible they might be or evidence-based they might be. You earn trust by really recognizing that people make decisions and judgments based on their values and their beliefs. And in order to really influence how those decisions are adjudicated, we have to, first of all, bring people to that conversation who have intrinsic trust. That's not always the government official. Often it is your personal doctor or someone in your community that you see as like you or who understands your circumstances and your value system. So to really engage at the community level in helping people process information and hear information translated by people that they really already trust. It's a long process, and it's not going to be easy to restore the trust that's been lost, particularly in recent years, but it can be done, and it's going to take all of us. I think part of the problem is that the people who are credible and have something to contribute often don't participate in the conversation. So we all have a little responsibility to influence the people in our world who share our values and beliefs in ways that help them be part of the force of making good health decisions, but also restoring that trust.
Yeah, and I like that you mentioned that it is something that has to be involved with everyone. But I have to ask, because we are in DC, is there anything that our political leaders could be doing to help, whether that's with the partnerships or the community-based level of rebuilding that trust?
Well, that's another very hard question. I'm glad that there are members of our government, our White House certainly, and some of our members of Congress who see this as a critical priority. But I also see plenty of people who are either intentionally or inadvertently detracting from that trust. And I think that's something that as Americans we all have to take ownership of, because we elected these people, and we need to make sure that we're looking for people who understand the process of science and respect it and are willing to participate in healthy controversy and debate, but not in polemics that distort or really use distortions of science for political ambition and aims.
Absolutely. Dr. Gerberding, thank you so much for such an important conversation. Really appreciate your time today.
Thank you for participating.